Hi, I'm Jean Priest. I work for Dr. Patricia Blanco at University Pediatrics, and we have been using the Ages and Stages questionnaire and the MChat for many years in our practice. And I just want to share a little bit with you about coding and reimbursement. The appropriate CPT code to use for both the Ages and Stages and the MChat is 96110. There are additional codes that mental health providers can use, other providers, but for pediatricians that will be the only one that you'll use. And if you use it correctly, it will facilitate your appropriate reimbursement. You will use a modifier 25 or a 29 if you're doing additional testing. For example, if you're using the MChat and the Ages and Stages questionnaire at the same office visit. The testing does not need to be performed by the physician directly one-on-one. It can be given by an office nurse, a medical assistant. It can even be done by your front desk personnel. In our office, we give the questionnaire to the parents right at check-in so that they can be working on completing it while they're waiting for their appointment. And if we don't ask them to finish it before they go back, they have the understanding that they can finish in the exam room if they need to. One thing that I'd like to note is that it needs to be documented in the progress notes, so the physicians will review it and they will need to document it, whether they do it at the time of the visit or afterwards. Either way is fine. Most of your payers will recognize this code, the 96110, but you need to check your contracts because some of them do not include it on their fee schedule. You may have to make a phone call and have it added for your particular contract. Medicaid is a major exception. They do not reimburse this code. We bill it every single time, but it has yet to be paid. The reimbursement varies widely. According to the current Medicare fee schedule, it's down to $7.43 or $7.43, and that has decreased, but our experience has varied quite widely. Blue Cross Blue Shield is one of the ones that pays fairly consistently and generally pays fairly well, but they will only pay for it once a year. So although we administer it every well-child visit and that first year of life there's quite a few, you will only get reimbursed the one time. And as you can see from the chart, it does vary in the amounts. From Aetna, we average about $8.10, even across all the different kinds of plans. Blue Cross Blue Shield, I have here an average of $44. Some of the plans pay substantially less, and we have on occasion gotten the actual full $60. Cigna averages $16.63, Humana $16.76, United Healthcare $17.29, and TRICARE $9.75. In summary, we are getting reimbursed inconsistently, even across the same plan. We may have an Aetna that pays wonderfully one time and doesn't pay the next time. So you really need to be on top of it if that's a concern. But in our practice, we do every single well-child visit. Every child, every well-child visit up through age 5 will have an Ages and Stages developmental questionnaire because we feel it's so vitally important to just good medical care to provide that for our patients. Screening's easily done, doesn't significantly increase the length of the office visit or the cost of the visit, and we thank you for your participation in the project.